Hi, good morning. So I'm gonna perform an easy pap. So before we perform the therapy, make sure we check everything in the patient's chart. Make sure we obtain any information, and then once inside, we sanitize our hands, wash our hands, introduce ourselves to the patient, such as telling them, "I'm Anthony, a respiratory care student from the respiratory department." So the doctor ordered this treatment because this would help them remove any secretions, open up their airway, help mobilize their secretions, and at the same time it will prevent any collapse. So with this one, this is non-invasive. So let the patient rest, sit upright with their elbows on the side on the table, and then make sure we check the patient's ID band to ensure they're the correct patient. And then after that, we always do our set of vital signs, our pre-assessment. Make sure we auscultate every time we do those to make sure if there are secretions present or any abnormalities in their lungs. And then once everything's done, we should wear appropriate gloves and then set this device or supplies. So if we use this one, make sure that we inspect for any cracks, or if it is not damaged. If it is damaged, make sure we replace it with a new device. So in here, there are two ports. So this one is for the oxygen source with its oxygen tubing. So this one is where we're gonna put up a pressure manometer. So this is a disposable manometer. So we have to put it in here, make sure it's secured and tight for both of them. And then if this is not in use, we can perform the therapy, but just make sure that this one is being covered to prevent from this port to being exposed to ambient air. So if make sure we hook it up, that make sure both of these are secured and tight, and then set the oxygen tubing to the flow meter, and then we can set it just low level first initially, maybe about 5. So we always prevent the patient to take a high inspiratory flow, not more than 60, to prevent any complications. And then with this one, it should be positioned like this, upright, and the patient should hold it like this. Let the patient take a slow deep inspiration, and then after that, allow the patient to take a strong exhalation, not in a forceful way. And then if the patient can tolerate, much better to reach about 3 to 4 seconds. And then with this, there's a mouthpiece in place. Make sure the patient would take a good seal with their tongues underneath, and then there should be a nose clip. So make sure also we tell the patient that the nose clip would prevent them from breathing in with their nose, and then let the patient also know that they should not obstruct in the back, because it's not ideal to obstruct it in the back. So another important thing with this device is we can also perform it together with a nebulization treatment, where there's a nebulization device, the adapter in place in front with its nebulization cup, and then we can use it with mouthpiece. Also, we can also have another option by using a mask if the patient could not tolerate using the mouthpiece, just make sure that we take a good seal with the mask. And then we can also start it by letting the patient do this about not more than 5 times, and then every after trial, let the patient rest for a few seconds and allow them to cough. And then also take note for the secretions, if they have like the color, consistency, amount for their secretions. And then when everything's done, turn the flow meter off, and then the manometer should be disposed because it's a disposable one. And then with this, we should not soak it or immerse it in water, because it's not allowed, except for the mouthpiece, where we can let it soak in still water and allow it to air dry. You can set it on the side with a clean paper towel, or also with a container. So every after treatment, we always do post assessment, re-auscultate again, listen to their breath sounds if it was able to help or clear up their secretions, and then obtain any vital signs. Let the patient rest to their previous position, and then once outside, chart everything, especially if what pressure the patient was able to reach, and also with their secretions and also vital signs, and then communicate with the staff.